Good morning, everyone. Thank you for joining us. We are going to get started on our webinar today, and I believe we're going to be opening with some remarks from Dr. Michael Fiore, who is our Executive Director and founder of the UW Center for Tobacco Research and Intervention.
Thanks, Sarah. And I just want to take a minute and give my personal welcome to everyone who's joining the webinar today. The big picture goal of Chapter 75, as you know, is to advance recovery by making addiction treatment facilities smoke-free and by offering tobacco dependence treatments as part of the comprehensive host of services provided. The most important message I want to give you is that all of us at the University of Wisconsin Center for Tobacco Research and Intervention stand ready to help every site to make this Chapter 75 be the best it can be, as well as to be implemented in ways that are as seamless as possible. So I look forward to the webinar as well. Thank you all for being here, and please know that we are committed to being as helpful as we can as you move through this intervention process over the next year. Back to you, Sarah.
Thank you, Mike, and thank you everyone for joining us today. We're really excited to be engaging in this work and working with all of you throughout the next few months and next year on changes to meet the revisions in DHS 75, specifically in Section 24(7) on tobacco treatment integration and smoke-free policies. So through our discussion today, we will be talking about the resources that are available to assist providers and clinicians and all of the facilities throughout Wisconsin, primarily looking at our 2 toolkits that we are really excited to be launching very soon. So before we get into the content today, we do want to take a moment to just hear from you, see who we have joining us today. There should be a few poll questions popping up on your screen. To see where in the state you are located, what your current work profession and position is, what is your current role, and then finally, if you are a DHS 75 provider, what services does your facility provide? So we'll just give just a few minutes for people to respond to those questions. Give another 10 seconds. Okay, so I believe we can end the poll now, and we'll share those results. We do see we have representation from all over the state. That's great to see. We do have some statewide representation as well, about 9 people that represent statewide organizations, but we have people from all corners of the state. That's great to see. Awesome. We have some DHS 75 providers joining us this morning. We have some representation from our tobacco program as well. See, we have a certified peer specialist joining this morning, some social workers, substance use counselors, as well as administrative staff. That's great to see. I'm happy to see the wide variety of audience joining us. As far as services, I see there's quite a few outpatient services represented. But we do have someone representing every service identified. So that's great. Really happy to see that representation. Thank you all for joining us and welcome. Hopefully you will all be able to walk with something that applies to your particular setting at the end of our day today. So we will close down our poll results and get into our outline. So we will start out today. We'll give a brief refresher for many of you, just a brief overview of Chapter 75 revisions, particularly in the service operations section and looking at the tobacco specific revisions. Then we will have a brief discussion of systemic approaches to tobacco treatment. What are the evidence-based best practices surrounding systemic approaches, and really why we are all engaging in this work. And then we'll get into the meat of our discussion, which is the overview of helpusquit.org, where all of the resources that providers might need will be housed and located, looking specifically at our two toolkits, the Tobacco-Free Policy Integration Toolkit, the Tobacco Treatment Integration Implementation Toolkit, and then a few additional resources that can supplement those two primary materials. So to get us started, let's get into DHS Administrative Code, Chapter 75. DHS Administrative Code, Chapter 75, sets the minimum standards for substance use prevention, treatment, and intervention services delivered across a variety of settings and levels of care in Wisconsin. We have providers on the line, so many of you are very familiar with this rule, but great to provide us a little bit of context for our discussion today. Chapter 75 was originally published in 2007, and since that time, it has undergone some minor changes, but there was not a significant revision in the last decade. So that is one of the primary reasons that we do see this large systems change and rewriting of the DHS 75 rule. So the new rule was published on October 25th of 2021, and it was rewritten to ease requirements for providers to deliver services while maintaining safety and quality of care standards. Some of the key revisions were to improve opioid use disorder treatment standards, to further integrate mental health and substance use care. But it also focused on updating language, removing some stigmatizing or outdated language and terminology. That language was revised to better align with language in certain state and federal policies. And it also was revised to further integrate some best practices into the rule. And that includes language on addressing tobacco use disorder and implementing smoke-free environment policies in substance use treatment settings. Prior to the revision, there actually was not any language around treating tobacco use disorder and tobacco dependence or smoke-free environments. So this is a big systems change that is represented in a much larger systems change for the DHS 75 revision. The new rule is effective on October 1st, 2022, and until that time, the current rule remains in effect. The revised DHS 75 applies to the following: a publicly or privately operated facility providing substance use treatment services in accordance with Wisconsin Statute 51.01 and Wisconsin Statute 51.45. It also includes publicly or privately operated facilities that provide substance use treatment services approved by the state opioid treatment authority. So in total, that's about 250 facilities throughout the state of Wisconsin that the revised rule applies to. What are the revisions pertaining to tobacco? In section 24 on service operations, specifically point 7, it says that every substance abuse treatment facility in Wisconsin shall have written policies outlining: 1, the service's approach to assessment and treatment for concurrent tobacco use disorders, and number 2, the facility's policy regarding a smoke-free environment. So there are two big elements regarding tobacco in the revision. What does this mean? It is, as I mentioned, a major systems change for all DHS 75 providers. As a whole, we recognize that there are many elements to the revision that providers and clinicians must comply with, but it also represents a major systems change in terms of tobacco treatment and providing a smoke-free environment for clients, staff, and facility communities as well. They are again required to have a written policy on their protocol for assessing and treating tobacco use and dependence, as well as a written policy on the facility's smoke-free environment. However, this does seem like a lot of work, and it is an important element. First and foremost, that's why I hear from UWC Treat and WinTip to assist providers in meeting these revisions and assisting with the system changes that you may have to undergo. Additionally, I really want to point out that within the rule, Chapter 75, not only this section, but the rule as a whole was written to provide flexibility that allows agencies to determine and write their own policies and procedures that meet the requirements based off of the protocols and other policies and practices that facilities are already practice on a day-to-day basis. So there's a lot of flexibility in the rule to meet client and clinical needs. Okay, so let's shift gears and take a look at the systemic approaches to tobacco treatment. On an individual level, we know that the best practices for treating tobacco use disorder and tobacco dependence are to use medication and counseling. Concurrent provision of medication and counseling is more effective than either alone, although using one option is certainly effective at encouraging quit rates and promoting long-term abstinence rates. Really, the third big best practice in terms of treating tobacco use and dependence is to engage in systems change. That systems change can be on a clinical level, on a statewide level, on a facility level, et cetera. There are a variety of examples of systems change that can be engaged in to create major changes in regards to addressing tobacco dependence. And there are many reasons for engaging in the systems change approach. In the rule of DHS 75, it requires facilities to have those written policies. So these changes are really on a systems level. However, the rewriting of DHS 75 represents a statewide systems change. So we're really happy and encouraged to see those changes. As I mentioned, there are many benefits to systems change approaches in that it ensures tobacco use is systematically assessed and treated at every clinical encounter. And this can effectively reduce tobacco use prevalence rates on a more community and population level. The benefits to tobacco treatment are that the interventions can also be tailored on not just an individual client level, but on a clinical level as well. And they can be tailored to work synergistically with client-centered interactions that all of our DHS 70 providers are already providing to their clients. And finally, systems changes really support a team-based approach. Not just physicians, but other clinicians have been shown to be similarly effective in delivering counseling, brief skills-based counseling to clients that can assist them in reducing or stopping tobacco use. We see that treatment delivery by multiple clinician types is also more effective than by a single clinician type, which really promotes that team-based approach. And finally, we see that it increases efficiency. It's efficient to break down each of the elements of a brief intervention within the healthcare team at a facility, which decreases the burden of amount of time that clinicians have to use to treat tobacco dependence, although we know that in as little as 3 minutes, we start to see a positive impact at increasing quit rates and long-term abstinence rates from tobacco use. So for consistent tobacco treatment provision, we need those supportive systems, those supportive prompts and policies and coverage. And so we're really going to focus on that policy element today of how can our policies support our clients quit tobacco use. I've kind of been referring to them as one element that facilities must have both a tobacco treatment policy and a smoke-free environment policy. We're going to break those out into two separate elements for a little bit of our discussion today, but important to note that they are strongly intertwined and do mutually benefit one another. When we look at the first part of tobacco treatment integration, we see that tobacco treatment is incredibly clinically effective. We have 7 FDA-approved medications. We know that brief counseling and coaching is effective at supporting clients to stop their tobacco use. So time and again, those are shown to be very clinically effective, including in this population that we're talking about today that may live with a behavioral health condition. We also know that tobacco treatment is cost-effective. Tobacco use treatments that range from clinical advice to medications to more intensive interventions on behalf of specialists are all shown to be cost-effective in relation to other medication interventions. In fact, tobacco treatment really is considered to be a gold standard in terms of healthcare cost-effectiveness. And finally, we see another positive benefit of tobacco treatment is that it strongly improves our client experience. Patients who are asked about their tobacco use by a provider report increased quality of healthcare. And similarly, clients who are asked about their tobacco use are more likely to make a quit attempt. If they're walked through a brief intervention, they're then significantly more likely to use our evidence-based treatments. One more benefit, I want to point out our graphic on the right-hand side. These are the 8 dimensions of wellness from SAMHSA, so they may look very familiar to many of you. I want to point out that tobacco is strongly intertwined with each of these dimensions of wellness. Some may be more obvious than others, such as the physical dimension or perhaps the financial dimension. But tobacco use really is intertwined in each of these specific elements. For example, in intellectual, smoking can impact brain health, and smoking cigarettes can lead to attention and memory deficits in adults. Additionally, for youth, adolescents, young adults that use tobacco products containing nicotine, this can affect the development of prefrontal cortex, which may lead to difficulty prioritizing or difficulty managing impulse control. Another example is looking at emotional benefits. Benefits to not smoking can lead to less stress, less anxiety, less symptoms of depression, better ability to fall asleep at night or sleep through the night. There are a variety of desirable characteristics in terms of best practices for tobacco interventions, primarily that it is based on our evidence-based best practices, but it's encouraged that our tobacco treatment interventions are tailored to the individual. So this is really consistent with how we would approach any clinical encounter in a Chapter 75 setting or facility. Additionally, tobacco treatment interventions in behavioral health settings are designed for the behavioral health clinician. They build on existing skills such as cognitive behavioral therapies, skills-based therapy, motivational interviewing, screening and assessing for certain conditions, etc. Additionally, tobacco treatment interventions are brief interventions that can be applied over time. They're fairly easy and convenient to learn and easy to implement, particularly in behavioral health settings. And finally, tobacco treatment interventions are very rewarding to provide. Shifting over to look at our tobacco-free policies, there are a variety of benefits, not just on a on a client level, on an individual level for individuals who might use tobacco products, but there are significant benefits for the community, the facilities, the staff, the volunteers, the visitors alike. It optimizes the work environment. It can increase productivity and satisfaction of staff and all community members within the environment. It's been shown to decrease absenteeism and hospital admissions, which can subsequently impact decrease workers' compensation or decrease lost productivity costs. We also see that there are increases in abstinence rates with tobacco-free policies. They can reduce maintenance, other costs such as maintenance or cleaning costs. It can decrease the risk of fires or other similar effects. We also see decreases in terms of health insurance costs and increases overall quality of life, not just for people who may be using tobacco and may be quitting, but for those around who may have previously been exposed to secondhand smoke or perhaps third-hand smoke. It increases quality of life for everyone involved. And finally, perhaps most importantly, tobacco-free policies support recovery not only from tobacco, but from other substances as well. We know that when people are concurrently treated for their tobacco while in treatment for other substance use disorders, are 25% more likely to maintain abstinence from all substances. Okay, so let's get into our resources for today. This is really our prime headline for the day, those toolkits. And all of our toolkits will be housed at helpusquit.org. Helpusquit.org may sound very familiar to many of you. This has been a long-standing website that's been around for a while that houses many materials pertaining to tobacco use and quitting smoking, particularly within the behavioral health population. It is currently going a bit of a reorganization and revamping that is in efforts to facilitate finding what individuals or visitors might need when they come to helpusquit.org. I'm sure you've heard me say in the past, there are a variety of multimedia materials that can be found at helpusquit.org. So these revamping and reorganization is really to assist clinicians in finding exactly what they are looking for. So you can already see this new banner located at the top of helpusquit.org, just to spruce it up a little bit and really indicate that you are at the correct location. I want to reiterate that helpusquit.org is not limited just to providers who provide DHS 75 services, but is for all DHS 75 providers. That being said, there is a section specifically to assist DHS 75 providers. Again, but this, however, does apply to all behavioral health providers. So it is a little bit of a dual function here, but we will continue to have behavioral health resources for an extended period of time at helpusquit.org, potentially in perpetuity, hopefully. So we can see when we scroll down on helpusquit.org, we will get to our three primary icons. On the left-hand side, you can see DHS 75. This is where the two primary toolkits will be housed, as well as other resources clinicians and providers might find useful. On the right-hand side, we have two other primary resources that have been very highly requested, very popular, highly reviewed, is our bucket approach and our free training and technical assistance. And I'll talk about those a little bit later, but we're going to stick with our tobacco-free DHS 75 tobacco treatment and smoke-free policy toolkits for now. So when you get to helpusquit.org, you'll scroll down to the three icons, click on Chapter 75, which will bring you to the DHS 75 landing page. This is really where all of our C-tree tobacco-specific information will be housed to assist clinicians. You can see a brief introduction here. On the bottom is a link back to the DHS 75 revisions and implementation page. I know you're all very familiar with this page. If there are any questions pertaining specifically to the rule, those should be directed to the State of Wisconsin DHS 75 page. But for any questions pertaining to the tobacco revision on how to implement those changes, those can be found here on our DHS 75 landing page. When you scroll down from this introduction, then you will see these two primary icons. On the left is our tobacco treatment integration toolkit, and the right is the tobacco-free environmental policy toolkit. Everything else that I previously discussed is currently live. When we get to this point, however, these two free toolkits are not live quite yet. They're currently undergoing an internal review process here at UWC-TREE, and then the next step will be to have some of our behavioral health partners and contacts provide some review to make sure that the content is as useful as possible for clinicians throughout the state. So we were very excited to give you just a little bit of a preview today and then launch them very soon this spring. Of course, we will advise you when the toolkits are live, and we'll be very excited to share those materials with you. So to get into our preview for today, you can click on either one of these toolkits, and our toolkit, the big ideas for the toolkits is that while they are two separate toolkits, they really are intended to be executed in tandem. So you can work on either one at a time, but utilizing them both together will provide a mutually beneficial relationship. We know that there is a relationship between providing a tobacco-free environment and providing tobacco treatment. For example, when we create a tobacco-free environment, there are people at the facility who currently use tobacco products. Really important to be able to provide them the resources that they need to quit or reduce their tobacco use if they are interested and ready to do so. Throughout the toolkits, there are a variety of multimedia resources that people can refer to. It includes downloadable tools. There will be case studies, particularly case studies in Wisconsin from Meta House and Journey, just to name a few, but there are a variety of case studies throughout the state of Wisconsin. There will also be sample and example policies and language that facilities can take advantage of. There are some videos, both for clinicians as well as clients, as well as some print materials, fact sheets, etc. Within the toolkits, they are meant to provide a step-by-step recommendation process, incorporating all of those best practices throughout the way. And then within that step-by-step recommendation, it's organized in a frequently asked question format that's really meant to provide guidance to any visitors who come to the website, that they can find exactly what they might be looking for when they arrive at the website. And we'll take a look at what that looks like, an example of what that looks like. Before I do that, though, I do just want to reiterate that there will be specific blank worksheets that are noted as tools throughout the toolkits. And these are really blank worksheets that can be used to plan and track work over time. So they're meant to be resources that you can print out and keep track of how it can be adapted and implemented at your facility. So when we start to take a look at our toolkit here, we're back on that DHS 75 page. We have our two sample icons, and we click on our tobacco treatment integration icon, and we come to our integration toolkit landing page. So we have a brief introduction and instructions of how to use the toolkit, and then we have our six step-by-step process for tobacco treatment integration. It's really meant to break down those big steps even further, so it is much more of a manageable approach. And then within each of the steps, there will be specific action items that facilities can engage in to ensure successful implementation and integration. And we see a similar organization for the tobacco-free environment policy toolkit, a bit of instructions on the top, and then a process graphic with our 6 primary steps towards policy integration, which is then further broken down into our frequently asked questions. So when we scroll down on each of those pages, we will see a format like this. Each of the steps is going to correlate with a section. As you can see here, for example, train staff or develop a tobacco treatment program. Under each section, you can see our examples of frequently asked questions here. Simply click on one of those questions to then expand a response and answer to that question. You can see a brief answer here, an example of some links that might pertain to that particular question. This question asks, how do we train staff to treat tobacco? And it gives an example of 4 different resources that you can utilize that are all free resources that you might be utilizing for within your facility to train your staff. There's a description on the right-hand side of what might be most applicable for your setting. So to get back to the toolkit, toolkit, you can simply click back on that header and you'll still be at that same page. So you won't necessarily be linked out when you click on any of the particular questions. It's just going to have an expandable list to answer that question, and you can see all of the same questions at the same time. So really meant to be easily navigable, and able to find the exact question that you might be looking for, and minimizing the searching that clinicians or visitors to the website might have to engage in. As I mentioned, there will be a variety of multimedia links, videos, samples, etc. throughout the toolkit. There are also the tools, as I mentioned. Here's just one example. There is going to be a checklist for each of the toolkits that can identify all of the necessary action steps throughout the process. So you can see one example here. Other sample tools will have more blank space for facilities and wellness teams, tobacco teams, to work on writing and developing work plans and protocols and policies, or developing a timeline and logic model, different elements that might be important throughout the process. So a variety of tools there. So keep your eye out as you explore the toolkit. Okay, so jumping back to helpusquit.org, as I mentioned, this is really where all of the behavioral health and tobacco treatment resources are housed. So we're back on that helpusquit.org page. We scroll down a little bit to find our 3 primary icons, and we'll talk about the bucket approach and free training and technical assistance now. Before I do that, however, I do want to point out this red section on the bottom here. You might note that it has a section for fact sheets, free training, meds information, posters, tobacco assessment forms, videos. All of the resources that are on helpusquit.org, many are scattered throughout our toolkits. But if you know that you're coming to the website and are looking specifically for a fact sheet, you don't have to search through the toolkit to be able to find those fact sheets. You can scroll down a little bit and can be directed directly to the fact sheet section, or the posters section, or the video section. So you may not come with a specific question of how do I do this, but may just need a simple material. So you can also navigate from the bottom of helpusquit.org. Okay, so jumping in to our 2 other icons there, we have the bucket approach training. Again, this is highlighted as a primary resource and icon because it has been very popular training, not just throughout the state of Wisconsin, as we'll see on the next slide, but many clinicians have completed the course and found it to be very effective and useful in their practice. The bucket approach training is a skills and competency training to provide evidence-based tobacco treatment that is tailored to smokers who are coping with behavioral health conditions. Throughout the training, it addresses many elements of the system's change, such as developing tobacco-free policies, but it also primarily provides guidance on how to provide tobacco dependence treatment, particularly that tailored treatment, and also provides information on how to assist staff who may be using tobacco products, what is an appropriate approach, and what resources can be provided. Bucket approach training is primarily for clinicians who work with individuals who may be using tobacco products, but there's also a variety of information there for program directors, administrators, quality improvement staff, and really provides the foundation of why this is important for everyone within the facility. Finally, it does take about 8 hours to complete, but offers 8 hours of free continuing education credits for completion. As I mentioned, the course has been very popular. It was launched in October of 2019, and as of August 2021, there were 999 total enrollees in the bucket approach training. Since that time, we've well surpassed the 1,000 enrollment mark. A majority have been from Wisconsin, over 500 have been from Wisconsin, but we have seen actually 40 enrollees from 41 different states and 6 different countries outside of the state of Wisconsin. So it does have a very broad reach and enrollment. When we break down what enrollment looks like by work setting, we see a majority, over 64%, do work in a primarily behavioral health setting. When we break that down even further, about 44% work in a mental health or substance use disorder treatment facility, and about 8.6% work in a primarily substance use disorder treatment facility. So we also see a variety of credentials have enrolled in the training. Those continuing education credits do apply to a variety of professions, including MDs, psychiatry, and psychology. Most people who complete the training have a Masters of Social Work, nursing degrees, Bachelors of Science, but we have seen many other PhDs, MDs, MPHs, NPs, MS, MHA, respiratory therapist, a variety of all of the letters have completed the training. So it is not just limited to one profession. Touching on our third and final icon is the free training and technical assistance. You may all be familiar with this resource as well. Through UWC Tree and WinTip, we do provide free training and technical assistance to all healthcare systems throughout the state of Wisconsin. However, we are providing specific assistance to DHS 75 providers, given the revision to the rule. This will include certain webinars, such as our webinar today, to further assist providers in identifying resources and utilizing those resources. However, we are also available for in-person or virtual staff trainings for your specific facility. And then the second element is our technical assistance. We are available to provide assistance in that process as well, that if someone is looking at the toolkit and may have some additional questions, we're certainly available to help kind of guide through that step-by-step process and find additional resources or answer questions that you may have. So to find that additional training and technical assistance, again, it can be found through helpusquit.org by clicking on the icon, or you can visit cliniciantraining.org directly, which will allow you to identify your regional outreach specialist depending on the region you are located in. I'm the Northeast Outreach Specialist located in Green Bay, but I have counterparts throughout the state. Susan in Northwestern Wisconsin, Amy is in Madison and covers the southwestern corner of the state, and Allie is in Milwaukee and covers Milwaukee and surrounding counties. So a brief summary to close us out for today is that DHS 75, particularly 0.247, represents a substantial systems change around tobacco use and smoke-free environments in Wisconsin. It increases access to resources in a population that has a particularly high smoking prevalence. We know that tobacco treatment and tobacco-free environments benefit not only individuals who use tobacco products, but the broader clinical setting. They impact staff and the clinic and systems as a whole. So for assistance in making those big systems changes, please visit helpusquit.org to access all of the available resources. Again, the toolkits are not live quite yet, but we are very excited to be launching them soon. I will note that we would love to hear from you on your frequently asked questions so we can further incorporate those within the toolkits or elsewhere on helpusquit.org. So as we continue to work with providers and learn from you, we will certainly be updating, and these will be working documents that can be updated based off of clinician needs and facility needs. So I think we have time for a few questions here. If there are any questions in the chat, feel free to enter them in the chat now if you have any questions. Before we jump into questions, I do just want to make a note that when you log out today, there will be a brief survey. It takes less than 1 minute to complete. Please feel free to complete that survey. It gives us feedback of how we can best assist you. There is also a space there for you to note any questions that you would like to be included within the toolkit or elsewhere on the resources. So any questions that you have right now in terms of implementation and integration, please share those with us. The second big element is that you will be receiving an email about a survey that looks at beliefs and current practices at your facility with regards to tobacco. Please complete that survey as well. It should take less than 10 minutes and will really provide us additional guidance in how best to assist all of you. So keep an eye out in your emails for that survey as well. And I will close things down and stop sharing my screen and jump into any questions that you have.
Hi, Sarah. Hi, everyone. I'm Karen Connor with UWC as well. And Sarah, there was a question, couple of good questions in the chat. I responded to one from Rob Adsit, and you'll see a long response to that about just the auditing of the rule, and the Division of Quality Assurance at DHS is responsible for that. So probably similar to how you've been audited for other types of rules that you're required to do. So there's a long description in there, but if you have more questions regarding those types of things, you can use the form that we shared earlier, or there's a contacts page at the bottom of that DHS webpage that I put in there. And then there was another question, Sarah, about the bucket approach training. Rob also asked, do I have to take the entire 8-hour bucket approach training, or can I pick and choose components of interest to my work?
Yeah, definitely. That's a great question. The bucket approach training is broken down into sections and short videos. Some are just 5 minutes, some are longer, about 30-minute videos, but it's broken down by topic. So individuals don't need to complete the entire bucket approach training. If you are looking for credit, you do need to complete the entire training if you want those credit hours. However, if you're just looking for the information, you can certainly register and find the particular video or element that might be of interest or relevant to your work. There are a variety of different vignettes and sample interactions between patients and clinicians, so can encourage and support clinicians in feeling more comfortable having an example conversation of how to talk, particularly about tobacco. We know that oftentimes not feeling comfortable is a reason that treatment isn't necessarily provided. So any way that we can increase that comfort is great. So there are many of those sample videos there, and you do not need to complete the entire training. And similarly, because of this, you can, if you do want to complete the entire training, because it is broken down into segments, feel free to work on it for 20 minutes a day, an hour a day, and can be completed over as long as you need to complete the training. If you do eventually want to complete the entire training, I believe once you register, you should have, I believe, up to a year to complete the training. So certainly you should have 8 hours within 1 year's time frame.
All right, I'm not seeing any other questions. But like Sarah said, we encourage you all to complete the post-webinar survey. And if you have any questions in there, feel free to put them there. Otherwise, reach out and fill out that form on the DHS 75 revision webpage if there's questions specific to the revision, or feel free to reach out to us.